Have you ever stopped to think that maintaining good sexual health isn't just about performance, it's about prevention, confidence, and daily care? Today, we're diving into a topic many men overlook until it's too late: how to take proper care of your penis to avoid serious health issues and stay at your peak mentally, physically, and intimately. Whether you're in your 30s or your 70s, these essential tips are relevant, practical, and could dramatically improve your quality of life. Hi everyone, I'm Laura, and in this video I'll walk you through 5 crucial tips that every man should follow to maintain optimal sexual health, plus a bonus 6th tip that most people have never even heard of. This isn't just about hygiene or desire, it's about avoiding real threats like sexually transmitted infections, STIs, erectile dysfunction, penile cancer, and Peyronie's disease. If you care about staying healthy, energized, and sexually confident, stick with me to the end. Let's get into it. Tip 1. Keep your penis active. Avoid disuse. Let's begin with a surprisingly simple yet essential truth. Disuse leads to dysfunction. Just like your arms, legs, and brain, your penis is an organ that needs regular oxygenation and stimulation to stay healthy. It's not just about sex or pleasure, it's about function and long-term vitality. Men who go long periods without erections due to age, health conditions, or inactivity may experience something known as penile atrophy, where the tissues become less elastic and blood flow decreases. Over time, this can affect not only performance, but also physical comfort and function. So, how do you keep things active? For sexually active men, regular healthy intercourse helps naturally keep the area oxygenated. Masturbation, when done in moderation and with awareness, can also be helpful. And for men who are not currently sexually active, pelvic physical therapy, or even a vacuum erection device, often prescribed in clinical settings, can promote circulation and prevent tissue decline. Think of it like keeping the engine running. You don't want it to seize up from lack of use. Tip 2. Maintain proper hygiene. It's non-negotiable. It might seem obvious, but you'd be shocked how many men neglect basic hygiene. And the consequences, they're far from minor. In countries like Brazil, penile cancer is surprisingly common, and one of its leading risk factors is poor hygiene. So here's what every man should do. Wash daily using neutral or glycerin-based soap. Gently clean underneath the foreskin if uncircumcised. Thoroughly dry the area after washing to prevent moisture buildup. Always wash the penis after sexual intercourse, especially when vaginal fluids are involved, as the pH of the vagina and penis differ. Imbalances can alter the local microbiome and increase infection risk. Good hygiene isn't just about being clean, it's about being proactive. You're protecting yourself and your partner and reducing the risk of infections, irritation, and even cancer. Tip 3. Avoid sexual intercourse with partial erections. Let's talk about something that often flies under the radar: sexual activity with a semi-erect penis. You might think, if I'm aroused, it's okay. But here's the truth. A penis that is only partially erect is structurally more vulnerable to injury. Engaging in intercourse during this phase can lead to repeated microtraumas, small tears, and internal damage that you may not even feel immediately. Over time, these can cause the development of nodules or scar tissue. Eventually, these nodules can harden and cause the penis to bend or curve abnormally, a condition called Peyronie's disease. It's painful, it's emotionally distressing, and it can severely interfere with intimacy. So what's the solution? Be patient. Wait for a full, firm erection before engaging in intercourse. Your future self will thank you. Tip 4. Limit pornography. Protect your sexual sensitivity. This is one that many don't want to hear, but it's too important to ignore. Excessive pornography use can desensitize your brain, rewiring your natural arousal response. Over time, this means your body might only respond to certain types of visual stimuli, making real-life intimacy more difficult or even unfulfilling. It's as if the brain becomes dependent on intense visual stimulation just to reach arousal. This leads to reduced sensitivity, delayed ejaculation or erectile issues, and emotional detachment during sex. The solution: set boundaries. Choose intentional, mindful viewing, or take regular breaks altogether. Reconnect with real-life sensations, real people, and real intimacy. Tip 5. Build healthy lifestyle habits. They affect everything. This might be the most important tip of all because it forms the foundation for your overall sexual health. The condition of your sexual function is directly tied to your lifestyle choices, both mental and physical. Here's what matters most. Diet. Focus on heart-healthy foods, leafy greens, lean proteins, healthy fats. What's good for your heart is good for your erection. Hydration. Dehydration affects circulation and energy. Drink water throughout the day. Physical activity. Regular movement boosts testosterone, improves blood flow, and supports mood. Avoid smoking. Smoking is a well-known contributor to erectile dysfunction and Peyronie's disease due to its damaging effect on blood vessels. Limit alcohol. Excessive drinking dulls nerve sensitivity and hormonal balance. Remember, your penis doesn't operate in isolation, it's part of a larger system, and that system thrives when you're living well. Bonus tip: sleep without tight underwear. Now let's talk about the 6th and final tip, something most men have never considered, but could be a total game changer. Avoid wearing tight underwear at night. Why? Because during sleep, your body naturally experiences nocturnal erections, a sign of healthy blood flow and nerve function. But when you're wearing tight briefs, you may be compressing your erections in your sleep without realizing it. This compression can cause minor trauma to the penis, fibrosis scarring over time, increased risk of curvature or Peyronie's disease. Instead, opt for loose-fitting underwear or simply sleep naked to allow your body to move and function naturally during rest. Your nighttime erections are part of your health. Let them happen undisturbed. You're in control. So there you have it. 5 essential habits and 1 powerful bonus tip to keep your sexual health in top shape. 1. Keep the penis active. 2. Maintain proper hygiene. 3. Avoid sex with partial erections. 4. Limit pornography. 5. Adopt healthy lifestyle habits. 6. Sleep without tight underwear. Each one of these is simple, but together they can completely change how you feel, perform, and experience intimacy. Prevention is power, and your health is in your hands. If you're interested in a natural, science-backed 7-second home remedy that has already helped over 60,000 men restore their youthful desire and strength, point your phone at the QR code on the screen or click the link pinned in the first comment. It might just be the extra edge you've been looking for. If you enjoyed this video, don't forget to like it, subscribe, leave your questions or thoughts in the comments below. Share this with someone who needs to hear it. Let's normalize conversations around male health, support one another, and age with strength, clarity, and confidence. Thanks for watching. See you next time. Stay healthy, stay empowered.